What if I told you that some of the health checkups you've been recommended for years could, after the age of 70, be causing you more problems than benefits? There's an uncomfortable truth that many older adults are unaware of. Every year, they go to their medical appointments confident that they are protecting their health. But what if some of those routine tests were actually the first step toward unnecessary procedures, overwhelming anxiety, or even a misdiagnosis? Recent research suggests that a significant number of tests in older adults lead to treatments that are not only superfluous but can bring lifelong complications. Most concerning is that the majority of people over 70 are not aware of this risk. In fact, one of these screenings, the first on our list, is linked to a risk factor that some studies compare to other harmful habits we already know well. You won't hear this in your doctor's waiting room. You won't see it in a television commercial, but the scientific evidence exists, and today, we are going to analyze it. In this video, Dr. Laura Rodriguez will reveal the 5 health checkups you should discuss in depth with your doctor after 70, and the surprising reality of what they could mean for your well-being. And believe me, you won't want to miss the one at number 2. Before we begin, we'd love for you to tell us in the comments where you are watching from and your age. Have you ever felt that a medical test caused you more worry than relief? We read every comment. And don't forget to like this video and subscribe for more valuable content like this. Now, let's talk about that first test. It seems harmless, but it could be quietly affecting your quality of life. Checkup number 5. The bone density scan. It seems like a simple procedure. A quick, painless scan to find out if your bones are at risk of fracture. But here's what isn't always mentioned after the age of 70. A bone density scan can generate more fear than real benefits. This scan, known as a DEXA scan, measures your bone density to detect osteoporosis. However, in older adults, the results are very likely to show lower density, even without a real imminent danger. The reason? Bone mass loss is a natural part of aging, like wrinkles. Still, many people are encouraged to take medications like bisphosphonates. These drugs, while designed to strengthen bones, can have significant side effects, such as jaw problems or esophageal irritation. Herein lies the dilemma. Dr. Laura Rodriguez explains that various analyses have shown that treating mild bone loss in people over 70 with these medications has a minimal impact on preventing actual fractures. Instead, patients are exposed to the side effects. Consider the case of Elena, a 78-year-old retired librarian. Her scan revealed osteopenia, a slight decrease in bone density. Her doctor prescribed a bisphosphonate. A few months later, Elena began to suffer from reflux and jaw pain. Upon seeking a second opinion from Dr. Rodriguez, the medication was discontinued, and they focused on a plan based on vitamin D, resistance exercises, and a calcium-rich diet. A year later, Elena felt stronger, had better balance, and had not suffered any fractures. A simple scan may seem like a good idea, but for people over 70 without a history of falls, a lifestyle-focused approach is often more beneficial. Strength training and proper nutrition have been shown to significantly reduce the risk of fractures. Don't let a number on a report lead you to a treatment you may not need. But there is another scan that can lead to something even more unsettling. Checkup number 4. The brain MRI for memory loss. When an older adult begins to notice forgetfulness, the fear of dementia or Alzheimer's is a natural reaction, and often, the medical response is to order a brain MRI. But here's the truth. These scans rarely provide the answers you're looking for. In people over 70, an MRI is most likely to show normal age-related changes, like small spots or slight atrophy. The problem arises when these findings, often of no clinical relevance, trigger a cascade of more tests and even invasive procedures that do not improve memory and can worsen the situation. Important observations have revealed that while many MRIs in people over 70 with mild cognitive complaints show some abnormality, a very small percentage corresponds to a treatable condition. This means that a large number of people go through the distress of hearing we've found something when it's actually no cause for alarm. Think of Carlos, a 75-year-old retired accountant worried about occasionally forgetting names. His MRI showed changes in the white matter, which caused him great anxiety. However, a standard cognitive assessment by Dr. Laura Rodriguez showed his score was normal for his age. They focused on improving his sleep, hydration, and doing mental agility exercises. In 3 months, his memory stabilized. Unless there are severe neurological symptoms, such as seizures or sudden personality changes, an MRI for mild memory loss may not be the most appropriate first step. A cognitive assessment is usually a more sensible option to start with. Now, get ready, because the next test is one you've likely had several times. Checkup number 3, the cardiac stress test. It is one of the most common tests for older people who feel fatigue or a slight tightness in the chest. The stress test aims to detect blocked arteries while walking on a treadmill. But after 70, especially in people without clear symptoms of heart disease, this test can often cause more harm than good. The reason is that it can produce false alarms that lead to unnecessary and risky cardiac procedures. The problem is its accuracy. Studies show that in adults over 70, the rate of false positives can be remarkably high. This can lead to follow-up tests like angiograms and even the placement of stents or bypass surgeries that were not necessary. Dr. Laura Rodriguez points out that research in the field of cardiology has found that a significant percentage of stents placed after a stress test were implanted in patients who gained no real benefit in their survival or quality of life. It happened to Michael, a 76-year-old amateur gardener. He mentioned at a checkup that he got a little more tired on hills. A stress test was scheduled. The results were inconclusive, so he was sent for a catheterization. They found a mild narrowing and placed a stent. That night, Michael had a reaction to the contrast dye and developed kidney problems. If you are over 70 and do not experience classic cardiac symptoms, a stress test might not be the best option. Alternatives like a resting electrocardiogram or a coronary calcium scan can be safer. And now, the checkup you probably didn't expect to find on this list. Checkup number 2, the colonoscopy. Yes, you heard that right. The colonoscopy, the procedure that examines the colon, is not always the wisest choice after 70 and is almost never recommended routinely after 75 unless there are specific symptoms. The risks increase with age. The preparation with powerful laxatives can cause dehydration and kidney problems. Sedation carries additional risks, and the test itself can have complications like bleeding or perforation. Dr. Laura Rodriguez summarizes it this way: the risk-benefit balance changes drastically with age. For people over 75, medical guidelines indicate that for every life saved by a routine colonoscopy, several people suffer serious complications. Even when polyps are found, many are so slow-growing that removing them can cause more harm than good. The case of Isabel, age 74, is one example. With no symptoms or family history, her doctor insisted on a routine colonoscopy. During the procedure, a tiny polyp was removed, but that night she suffered a small intestinal perforation that required hospitalization. The U.S. Preventive Services Task Force recommends stopping routine colon cancer screening at age 75 for most people. Non-invasive alternatives, such as stool tests, are much safer. And now, we've come to the most overused and potentially harmful checkup. Checkup number 1. The full-body computed tomography CT scan. These scans are promoted as the ultimate way to detect cancer early. But here is the shocking truth that Dr. Laura Rodriguez shares with us. These scans expose your body to a considerable dose of radiation. For an adult over 70, the risk of this test triggering a series of follow-ups, biopsies, and surgeries for insignificant findings is incredibly high. And the irony is that there is no clear evidence that full-body scans without symptoms save lives. Each scan emits radiation equivalent to hundreds of chest X-rays. According to some studies, the increase in the use of CT scans could be linked to a percentage of cancers similar to other known risk factors. This means a scan that was supposed to prevent a disease might actually be contributing to it. The scan can detect harmless nodules or cysts that are simply part of aging, but the moment they appear on the screen, the alarms go off. Dr. Rodriguez tells us the case of Robert, an 81-year-old hiker. He had a checkup that included a full-body CT scan which showed a tiny lung nodule. This triggered a biopsy that, although the result was benign, caused a partial lung collapse and months of recovery, all for something that likely required no intervention. Experts, including the American College of Radiology, are clear: full-body CT scans should not be used for general screening in asymptomatic adults. The potential for harm is significant, and the benefit is unproven. A safer approach is to listen to your body and undergo targeted tests only when symptoms warrant it. There you have it. 5 checkups that, while seemingly useful, can be harmful after 70. Sometimes in medicine, less is more. Always ask, what will happen if this test finds something? If the answer isn't clear, or if the risks outweigh the benefits, it may be time to reconsider. As Dr. Laura Rodriguez always reminds us, true prevention starts with a healthy lifestyle. Now we want to hear from you. Have you had an experience with a test that turned out to be unnecessary? Share your story in the comments. Thanks for watching.